Hmm. Doctors.
Doctors.
Doctor, give me the news.
Doctors without borders, but with barriers.
Doctors without barriers.
Yeah.
Doctors without boundaries.
Oh, they'd love to not have boundaries too, especially if you're queer. Like the questions and like the tone of voice when they're asking you like sexual history is insane.
Mm-hmm.
I had to go to Planned Parenthood for birth control once when I was out of town. But they were just like, so what genitals do the people you have sex with have, and what orifices do you put those genitals in? And it was just like, this is a lot.
Mm-hmm.
And it was just so uncomfortable. And I know they didn't mean it to sound judgy, but it just kind of sounded judgy.
Yeah. Just the phrasing.
Yeah. And it was like, it was so specific. And it was like, tell me about the genitals and tell me what holes they go into.
Did they use the word holes?
No, it was like, what types of sex do I have? Oral, anal, vaginal. But it was just like, I'm here for birth control. What do you think?
Check boxes.
Yeah.
All right, ready?
I'm as ready as I'm ever going to be now that I've cleared these notifications that were annoying.
All right. Hey, brats. My name is Robin, and I'm trans.
My name is Ben, and I'm trans.
And today we're going to the doctor.
Yeah.
Ben actually just went to the doctor.
Yesterday.
Amazing.
After 2 years of avoiding doctors due to medical trauma, I finally went to an inclusive practice, and I got care that didn't feel bad.
Yeah.
And like you'll know by now that I'm hopefully starting T in less than a month, which is already a moment of joy. But like, it's also just a moment of joy that like, I went to the doctor. He did not like how my thyroid felt, so I have to get an ultrasound on my thyroid. So like, on the off chance I have thyroid cancer, because I am at increased risk for parathyroid something, basically growths on my thyroid that are bad. I now know that I need to get that looked at, and that could potentially save my life.
Yeah, absolutely.
And that's pretty good.
Yeah. I think we've both learned that like queer-affirming medical practices exist.
Yeah, that's so new to me.
Yeah.
Literally less than 24 hours new to me.
Yeah. So special thanks to Chris, Ben's husband, for tracking that down. I'm just so glad that you found that doctor, because that was something that was an issue for a really long time.
Yeah, I was worried I was slowly dying, but my new doctor, called me out for being someone who catastrophizes and was like, I bet you your organs are fine, other than maybe your thyroid.
Yeah.
Because you're alert and you're sitting here and you seem fine. And if your organs were not fine, you would not seem fine. And like, and then he did like I'm going to poke your liver. And he was like, your liver feels fine. And I was like, well, I was kind of worried about my liver. So that's good. But now it's done. I hated it, but it's done.
Yeah.
Like, I was at stage 2 hypertension levels of blood pressure at the start of the appointment. And then by the end of the appointment, I was in a normal range. That's how messed up I was. Because it's traumatic. And that didn't used to be a problem for me when I was growing up. But in the last few years, it's been very much at the beginning of every doctor's appointment, your blood pressure is going to be through the roof, and they're not going to let you leave until it comes down.
Yeah, especially if you have any kind of doctor-related anxiety, which is a lot of us. But that's great that they actually recognize that and like came back to retest you at the end of the appointment.
And the best part is the nurse who took my blood pressure at the beginning was cis, and she was great, and she was super wonderful. But the one who got my good reading was non-binary, and like, I don't know, something tells me that had something to do with me feeling better. It's like
I bet it just like brought your
parasympathetic nervous system.
Yeah.
But we were like talking about how we both struggle with being misgendered all the time in medical settings. And like, that was just like, oh, okay. I feel safer now.
Let's do a moment of joy. Today, I want to share one from Brooke, who is our favorite muscle mommy.
She is going to become my long distance personal trainer if I have anything to say about it.
Yeah, exactly. But she actually works in a gym. And so we get to hear a lot of her like gym stories and everything. Brooke says, I had a training session interrupted by some random guy because the front desk guy fucked off. And he led off with, sorry to bug you, ma'am, but there's nobody up front. And she says, I take the wins where I can get them. But it can be like just the little things like that can be a big deal sometimes.
Sometimes one singular ma'am for Brooke or sir for me can be the difference between the worst day and the best day.
Mm-hmm.
It's amazing.
Yeah.
Especially from a stranger.
It doesn't take much. Yeah.
Yeah.
And like, especially like when you're going into a stressful, potentially situation, like going to the doctor, it makes a really big difference. And like, you have a lot of history with military healthcare or like through TRICARE or whatever, at least.
Yeah.
But just like getting mammed like 50 times before you even like see a doctor.
Yeah. My husband, bless his beautiful, kind, caring soul, actually went out of his way to switch our TRICARE insurance to it. Like you can pick different packages under the TRICARE umbrella. And he picked the one where you get to go to civilian doctors because every time I go on base to get any kind of medical care, they start mamming me before I'm even like at the desk to give my name, because I think it's probably just part of the cultural like status and also training, kind of like how at Homophobic Chicken they always have to say my pleasure.
Yeah,
like it just, they always sir or ma'am you, and it was a nightmare. So now I get to go to civilian doctors, which still isn't that much better, but it usually doesn't come with a sir or a ma'am, which
it's less likely to.
It's way better. But now
I did one time go to a doctor. This was from like an injury that I had, but I went to a doctor and the like receptionist person, when she called me up, called out sir, which is like never a great way to start it. But then she was also the person who like set me up in the waiting room and everything. And once we were back there, she's like, did I just misgender you? I'm really sorry. What do you want me to call you? And so like, that was a really nice, if not moment of allyship, just like, it was a good example of like how to save yourself if you like slip up.
Good accountability.
Like, it happens, yeah. So that was really nice. I would have preferred not to get the sir to begin with, but like it was really nice. And then we got along pretty well too. I only went to that doctor like twice, but because it was like a specialist. But she was, I think I had her both times. She was very nice to me.
And did she remember the second time?
Mm-hmm.
Well, then good for her. That's allyship right there.
Mm-hmm. Yeah, exactly. Yeah.
But she must see a lot of people. So she remembered the second time. That means she felt really bad.
Mm-hmm.
Which like...
Yeah, exactly.
I'm not saying I want everyone to feel bad, but like, it's okay to feel a little bad.
Mm-hmm. Yeah.
Hot take.
Yeah. And the second time when I went back, like I had just gotten a manicure and stuff because I was like off work for a while because I was on like workers' comp or was supposed to be. That's a whole story in and of itself. But it was cool because we just like did girl talk or whatever, like talked about her nails and stuff. It was affirming in the end.
Yeah. It's actually why I have my he, him, his shirt. I think I've worn it on the pod in a different recording. Whether people will have seen it by the time this airs or not is a different question.
I think probably that one we're going to air first, but
yeah,
I still haven't watched it back.
But that's why I bought it, is to wear to medical appointments.
Mm-hmm. And you told like the receptionist,
the non-binary nurse. I had a non-binary nurse at the end of my appointment yesterday, and they were like, "Hi, my pronouns are they, them," and I was like, "Oh, hi, I'm Ben. My pronouns are he, him," and they were like, "I can tell, and that's awesome. I should get one of those because I introduce myself with my pronouns here every time, and I still have patients misgender me, and it's like,
it's crazy.
Why are you here?
It's so crazy. Yeah,
yeah.
I have at work I have like a pronoun tag next to my name tag, and still like people misgender me. It's not nearly as bad as it used to be, but like it's amazing how many people just like either ignore it or like just don't register it at all.
Yeah. My veterinarian yesterday had a she, her pin.
Oh my God.
Which I got to remember to make her a moment of trans joy at some point.
Yeah, she sounds lovely.
Yeah.
Yeah.
Shout out to Dr. B.
On the previous episode that you were just referencing, you shared a moment of joy, which is like very relevant to what we're about to talk about. So why don't we come back to that really fun experience that you just had? Because, like, I know for a really long time, you haven't been going to your doctors and getting your other chronic health issues taken care of.
Yeah, I've been raw dogging life without a metabolism for almost 2 years.
Yeah.
And
because you've got a autoimmune thyroid issue.
Yeah, autoimmune thyroiditis, sometimes known as Hashimoto's thyroiditis. It is one of the most common thyroid diseases. But what is uncommon about me is I got diagnosed 20 years younger than the average person. So my body has been attacking itself for 2 decades now. I'm about the average age of diagnosis now.
Yeah.
And like I had gone to the doctor, last time I went to the doctor for it, when I went to get my blood drawn, the phlebotomist misgendered me. And then before this tattoo was this tattoo, there was a Deathly Hallows symbol right here, which is so beautifully hidden now. But then the phlebotomist like pulled up her sleeve and was like, I've got one too. And isn't Harry Potter the best? And J.K. Rowling is so great. And then I just stopped going to the doctor. And then we were recording recently, and I had very luckily brief but pretty intense kidney pain when I had to pee so bad.
So bad.
And that freaked me out because I can ignore chronic illnesses and just allow myself to slowly creep towards death at a slightly more increasing pace. But for an acute infection that I could have had, I could not. So that scared my husband, and he did some Googling, and he found a trans-affirming and like queer-affirming clinic that does gender-affirming care and primary care. And they took our insurance. So I made an appointment, and I had to wait like a month and a half. But that was yesterday. And it was
amazing.
It was a nightmare, but it was a good nightmare.
Yeah, because I know you were so stressed out going into it.
I was so stressed out that I became a zombie last night, just imagining getting a no for gender-affirming care, or imagining that I'd gone without meds for so long that I'd messed up my body like beyond repair, which would end up leading to a no, even if I would have otherwise gotten a yes. And I was just crying all day yesterday because I was so scared. Like I accidentally started crying at the veterinarian, which I loved my veterinarian. I love her so much.
Oh, I cry at the vet too. It's fine.
Yeah, but it was like she mentioned her girlfriend, and I was like, oh my God, you're queer. Thank God, because I'm so scared because I have an appointment with a gender-affirming clinic and I really want to go on T, and I'm so sorry I'm telling you this, and I'm so sorry I'm crying. I'm just really scared. And she was so cool about it. Anyway, I got to the doctor before the intake nurse could even introduce herself. I'm already crying. And she was like, did I do something wrong? And I was like, you didn't do anything wrong. The last 6 years worth of doctors have done a lot of things wrong, and that's why I'm crying, and I'm going to be okay. My blood pressure is not. She took my blood pressure. My blood pressure was at stage 2 hypertension levels. Then she does all the things, checks my oxygen and my temperature, whatever. Go to the exam room, meet Dr. And it was very much like, so what's going on? What's your medical history? What are your risk factors? And then my thyroid doesn't feel great, like physical exam wise, but he basically said, as long as my blood work is not any surprises beyond what I already know is going to be wrong, which is my thyroid and my cholesterol, I can start T in August, which depending on when this comes out, it might have already happened.
Yeah, most likely.
So if you're hearing this after August 15th, I might be on T. But he's going to start me on a low dose. That way we can monitor how my thyroid is adjusting to being back on meds and how it interacts with my cholesterol and my platelets. But I might be going through puberty soon.
So exciting.
And at the end of my appointment,
about puberty, we can both be going through it.
Yeah. At the end of my appointment, though, my blood pressure was normal. Gender-affirming care saves lives.
Yeah. Number one, good on them for knowing, like, we should check his blood pressure again because of the anxiety.
Mm-hmm.
And also for your doctor for noticing what should be an obvious thing, which is maybe the untreated gender dysphoria is making it harder for you to manage your other chronic health problems.
Well, he was like, ask me what dysphoria looks like for me. And I was just like, if I know I'm being observed by someone who doesn't recognize my identity, I'm puking.
Mm-hmm.
If I'm looking in the mirror too long when I'm brushing my teeth, I'm puking. And he was just like, yeah, that's not sustainable.
No, absolutely not.
Yeah. Like, I have agoraphobia because I don't want to be puking.
Mm-hmm.
And I'm not even safe from my own reflection. Sorry if anyone here has emetophobia.
Oops.
But it's
we can put that in the triggers.
Yeah. And like, it's happened at work. It's happened when I'm driving my car. If I start thinking about having been perceived, like I've had to pull over. It's bad. And he was just like, I can tell that a lot of your medical, he didn't use the word medical negligence, but I know that what I've been doing is medical negligence. But basically, I can tell that your mental health and your hesitance to access care is all very heavily affected by gender dysphoria. And so I think it makes perfect sense to treat them both cautiously at the same time.
Mm-hmm.
Thank goodness.
And
He's
a lot
wonderful.
of justified bad experiences too. Like, do you want to talk about the last time you went to or attempted to go to an endocrinologist for your thyroid issues?
I mean, I didn't even get a referral from my primary care. I was like, this is my pre-existing conditions. This is my family history. And it was like, maybe if we can get your health in XYZ, maybe we can talk about it. But we're not going to talk about it. And I was like, well, then I need to quit nicotine. And the doctor was like, well, you clearly use it for a reason, and we don't want to get rid of your coping, like your crutch, because it's a crutch for something. And like, we need to get your mental health to XYZ for you to quit nicotine. And it's like, so how many things do I need to get in a row in order to be mentally in a place where I can get them in a row? Because all of these things come back to the gender dysphoria, other than the thyroid.
Mm-hmm.
But the thyroid, being diagnosed at onset of puberty, is what I blamed my gender dysphoria on for so many years. I was just like, oh, I feel wrong in my body because my body's attacking itself. So like, it's all just a weird tangled web of chronic illnesses. Because I don't know, to a certain extent, I feel like gender dysphoria is a chronic illness. And it's something that can be treated, but there are some things with it that aren't permanent. You have to be treated for it forever. Unless, like, I get a hysterectomy and then I could consider not being on T.
Mm-hmm.
After I have all of the permanent changes that I want.
Yeah.
But,
and to be clear, it's not an illness, but it is chronic.
The dysphoria itself is the illness. Like, for me, not every trans person has dysphoria, or not all trans people have the same dysphoria. But for me, it impacts my life so negatively that the dysphoria itself feels like an illness. The transness is not an illness, but the dysphoria and the effects it has on my body makes me quite literally ill.
Mm-hmm.
In like one of the most stereotypical illness symptom ways.
Yeah, very much so.
Yeah.
They put gender dysphoria in the DSM-5 specifically because there was a need for like a specific diagnostic code to help us get treatment for this stuff.
Mm-hmm.
And so I believe if you actually like read it in the DSM, they're like, by the way, this isn't an illness. We just need a way of like putting a code for insurance or whatever.
Yeah.
But because there's, I don't know, it affects so many things health wise and like.
And like for me, the illness isn't even like, it's based on society. So if anything, society is the illness because
Society is the illness. You heard it here first.
the
folks.
things that make me feel most dysphoric is knowing how I'm being perceived by others. It's not necessarily how I perceive myself. And like, so when I'm looking in the mirror and I start feeling sick, it's not because of how I look to me. It's because I look at me and I imagine what other people see when they look at me. You know?
Yeah. And I think every time I've heard you talk about your dysphoria, it has been like others focused. Just like the ways that you were treated and referred to and everything based on how other people in the world are seeing you.
Yeah. Granted, like I'd love to have a beard, but if society saw me as I wish I was being seen, I don't think it would be as important to me.
Mm-hmm.
Because a body is just a meat suit that your soul and brain ride in. And I don't think it's that important. But people matter to me and how I am seen matters to me.
Yeah.
Which is weird.
Mm-hmm.
I feel like it's probably not common, but I'm sure I'm not alone.
No, you're definitely not.
Yeah.
It's probably more common than you think.
It just was like, the doctor was very focused on how I felt about certain things. And it's like really, I don't know how to explain it because how I fit into society affects me in a bigger way than how I feel within myself.
Mm-hmm.
Other than periods, I hate them. I've always hated them. They've always been bad. But another good thing about my doctor is I was like, yeah, my insurance doesn't cover like hysterectomy if you're a dependent. And he was like, we've got a gender inclusive OBGYN here. And if we find a medical reason, we can get that taken care of. And just based on what you told me, I think we could find a medical reason. And I don't know how creative he was implying he was going to be, but I'm pretty sure you could literally find a medical reason. But even if you couldn't, I feel like him and his OBGYN would be like, oh, I think there's fibroids. We might as well open them up and see. Oh, we're already here. You know? Which is, that's allyship.
Yeah. Right. How crazy. Well, first of all, it's crazy to think about how crazy it is to have a doctor like be an ally and fight for you, you know.
It's the first one I've ever had, and I'm 33 and I've known I was trans for 6 years. Years.
For 6 years.
I haven't been in a sex year in a minute.
I haven't had half of the negative experiences that you have had, but I still like anytime I go to a doctor, am like really nervous about how they're going to perceive me and just our interactions and everything like that. Yeah. I forget where I was going with that, but
I did just remember the point I made. This is our second draft of this recording because microphones are rude. But one of the points I made is like, I've had at least a half a dozen doctors deny me testosterone based on my health history. And I, after a few, would start asking, my husband's always with me because of my anxiety. It's like, if he came in here with the exact same chart as me, would you be putting him on HRT to get rid of his testosterone for his health? And they're like, no. And then I'm like, well, then why can't I have the hormones I need? And they're like, because I said so. And it's like, so I don't even get to count as a full person because like his hormones are valid because he's cis, but my hormones that I want aren't valid because being trans is wrong. Because that's the message that sends to me.
Yeah, it's just gatekeeping. Like, it's just based on their own opinions and feelings, not based on any kind of medical standards.
My number one piece of medical advice for anyone listening who has experienced gatekeeping is you get on that Google and you look for a gender-affirming, queer-focused primary care clinic, and you see them for everything. Everything. The clinic I'm going to, they have like rotating specialists that come in certain days of the week. They've got a cardiologist that is queer. They've got an OBGYN that is queer. They've got a dermatologist that is queer. And I'm going to get to go to all of them. And they're all queer.
That's amazing.
They've got a therapist that provides short-term therapy as a bridge to give you more time to find a longer-term one who's non-binary. And if I get to go see this person, which my doctor really wants me to, it'll be my first time actually having a queer therapist in my life that I know of. Because it's not like therapists really share their personal.
Right. But yeah, I have a queer therapist for the first time, and it's made like a huge difference. It's a big deal. Just to have somebody who like gets what it's like to some degree.
And like everyone at the trans affirming clinic I'm going to introduces themselves with their pronouns. Every single person. Which makes you not feel like a weirdo for needing to specify yours.
Mm-hmm.
And like most of the people that I worked with were cis, as far as I could tell. But when cis people introduce themselves with their pronouns, it makes you feel like you're not taking up extra space when you specify yours.
Yes.
And it's just, it was like a warm hug.
They're not acting like you're burdening them with like using your correct pronouns.
Yeah. And it's like, it adds what, like 3 seconds to your interaction with a patient. And I know you're like supposed to be limited to 15 minutes. Dr. took an hour and was late to a meeting with me. But like, it adds 3 seconds. Big whoop. Just say what your pronouns are and invite someone else to share theirs.
Mm-hmm.
Not that hard.
Yeah. And you're just like helping provide that feeling of safety.
And if someone gets mad at you for sharing pronouns and they say they don't use pronouns, like let them be mad about it. Because they use pronouns.
Mm-hmm. They sure do.
Like even my friend who doesn't use gendered pronouns is still okay with being referred to as you, which is a pronoun.
Yeah.
But if I'm like, hi, Cortez, how are you? I don't get yelled at for, like, I'm allowed to say, how are you? I don't have to say, hi, Cortez, how is Cortez? Like, they're still pronouns.
Mm-hmm.
Everyone uses, as far as I know, in English, at least some pronouns.
Mm-hmm. Yeah.
So calm down, anti-pronoun people who are all listening to this podcast, obviously. That's our demo.
Mm-hmm. How many episodes in and they're still like hate listening to us, I guess?
If you are hate listening to us, I challenge you to go to a therapist and see if you might need to go on a gender journey. Because if you're hate listening this many episodes in, I feel like there's something going on. You know? Not necessarily, but why would someone invest that much time unless they were curious?
I had a coworker once who, this was like long before me coming out, but they've been on a long journey too. Not a gender journey, but like
life.
I think life journey, yeah. But they made a comment about a customer. They were like, I couldn't tell if they were a man or a woman, and it made me uncomfortable. Something like that. Like that was almost the exact phrasing. And I had a random moment of boldness, I guess. And I was just like, well, it's probably because you're insecure in your own gender and maybe seeing that person trigger something that you didn't know you were dealing with. And like, at first I was like, I can't believe I said that. That was a dumb idea. But they were just like, yeah, you might be right about that actually. And like, they have become very accepting of trans people since then. Like when I ended up like coming out to them or whatever, eventually they're just like, all right, cool, whatever. Like, and it never came up again.
And were they like really able to like switch how they referred to you easily?
We don't work together anymore. But
because I'd be curious, just curiosity. Because like if it was an easy switch, then it'd be really clear that they actually did a lot of thinking about that interaction, and that would be really cool. But I feel like people who get mad about transness, they may not necessarily be trans, but there's something about gender roles or like societal expectations that is upsetting them. Like that's the only thing that makes sense to me. There's just something about like why do you need to know what's in someone's pants? Especially when it comes to like trans kids. It's like when you're getting freaked out about trans kids, what you're doing is getting freaked out about their genitals.
Mm-hmm.
And we're the ones sexualizing?
Yeah.
Okay. Like, I don't care what anyone's genitals are. Even if I am in a relationship with them, I don't care. Be chill.
I think a lot of that too is just from a lifetime of internalizing people trying to force gender roles on you. Like cis people get the internalized misogyny too. And even if you don't know that it's like going on within you, because it's not something that you've like had to process before, I think there's something within that that is getting triggered a lot of times. And I think there's definitely an aspect of like that whole like just seeing somebody who's gender nonconforming in some way can feel threatening at first because it just like makes you think about what you've been forced to hold on to when it comes to like your position in society and stuff like that. And that can like bring stuff up that you're not necessarily processing.
Yeah, it feels like jealousy.
Mm-hmm.
Like, why do you get to say, I'm not going to follow these norms if I have to? And my answer to that is you don't.
Mm-hmm.
You don't have to. And if you're not trans, that won't make you any less of a man or a woman or whoever you are. Like, you can just do what feels right for you and you're still going to be okay. And anyone who doesn't like it is just outing themselves as someone who doesn't deserve to be in your life.
Mm-hmm. I saw a TikTok once. It was like a cis straight dude who always has his nails painted. And somebody in his comments like made a comment about it. And like he replied to it and he was like, "Oh, I'm so sorry that you've lived so much of your adult life realizing that one of the benefits of being an adult is being able to do whatever the fuck you want and not like worry about what people think about it."
Yeah,
He's like, "I just do it because I want to do it and it doesn't matter."
Yeah.
So I do it. Yeah.
We should all be allowed to make our own choices, no matter where you come from, whether you're on a gender journey or not. And you should be allowed to have a say in your medical care.
Yes.
And you shouldn't be gatekept. Even if you are disabled, you shouldn't be gatekept, because I see so many horror stories online about autistic people being denied HRT or any sort of medical transition because they're acting like, okay, you're autistic, so you can't actually know. And that's just paternalistic, infantilizing, gross.
Yeah.
Gross.
It is.
Like literal small kids, maybe not infants, but like small kids can know who they are. So even if you wanted to fall under the infantilizing line of thought, which I think is gross, why can't autistic people also know who they are? Which, again, they can, and they do.
Very much so.
Yeah. And then, like, there's the different illnesses that make people get denied T. Like, certain blood disorders can make you get denied T because it can increase your platelets. But, like, I don't have that, thank goodness. At least not yet. I could end up with extra platelets. But where I was sitting and where I'm still sitting is I would rather live less time feeling okay than to be living longer but being scared to leave my house. And I should be able to have a say in that. And everyone should be able to have a say in that.
Not to even mention like the long-term effects that living like that has on your body. I mean, a lot of the like heart issues and like hypertension and stuff like that, you're going to get that from having to like live in fear for your whole life, or just like drowning in gender dysphoria that nobody will help you treat.
Yeah, I can say with certainty that my body is in a significantly worse condition now than it was even just a few years ago because of constantly living in fear anxiety, depression, having unhealthy coping for all of these things that I'm feeling, and knowing that the thing that will help me the most is the one thing that I'm asking for and doctors are saying no to. As if I can't be smart enough and know myself well enough to know what the best course of action for my own care is. Which I get it. I'm a mess and I am broken, especially my thyroid. But that doesn't mean I can't know how to fix myself. But there are certain tools that you need to fix yourself in my situation that you can't get without a prescription. Especially when you have like the heart disease risk I have. Like the intake nurse and the doctor were both like, have you ever tried to access testosterone? Like not through the proper channels. That's not how they worded it. But I was like, no, because I know with my body and my family history, I need to have a doctor who knows me and knows how to watch for warning signs on my blood work. And then they were like, good, that's the right thing.
Yeah.
But like, how long am I supposed to live like that?
Mm-hmm.
I was getting to a point where I was like, who's got this back alley testosterone and some needles? Like, I was getting there, like, but I'm just glad that I found, thank you, Chris, that this gender affirming clinic exists. There's a couple nearby because we are, like, there's people who go to these clinics from hours away, and I was at least an hour away. But there's at least two within an hour of us because we're close to a big city.
Mm-hmm.
Not super close, but close enough that there's resources.
Yeah, and you should let me know offline where they are and everything, because that might be a thing that comes up for me at some point.
I will. Yeah, one of them is the one I use, and then the other one is the one that my buddies, Cade and Grubb, shout out to Cade and Grubb, happy belated 5-year anniversary of Chris's campaign in D&D.
Yay.
Which we had already had a different campaign before then, but Chris's campaign is the one we're in now. I love them. But I told them I'm probably going on tea soon, and they sent me all the heart emojis and congrats. Because they've been telling me to go to theirs forever, but theirs is even further from home than the one I went to. And I just didn't want to go to that one. It felt like an eternity away. And I'm glad that I finally went somewhere.
Yeah. And even aside from the hormones, like, I just, like, as your sister, I feel like such a sense of relief now. Because, like, I don't know, I worry about you too. You know?
I was so worried that I had destroyed all my internal organs, but Dr. says I'm probably fine.
Yeah.
And he did not make a big deal about how my thyroid felt, but just the way he did like the physical exam of it and was just like, might want to get that ultrasounded. That has me a little concerned because he had already pointed out verbally to me that I could catastrophize. So I feel like he might have said more if he hadn't noticed that about me.
Mm-hmm.
But we'll see. If I have thyroid cancer, it's one of the most treatable cancers because you just remove the thyroid and you're on the meds I'm already supposed to take.
Mm-hmm.
Like, as long as it's not metastasized, if I have it, I probably don't. I probably just have like nodules that aren't cancerous. But there are way scarier things for him to be worried about. And I'm trying not to catastrophize.
Yeah. Yeah, one step at a time.
Yeah.
But it's good that you finally found a gatekeeper doctor who's on the right side of the gate, I guess.
Yeah. He wants to like gatekeep TRICARE's policies in an inclusive way.
Mm-hmm.
Like, oh, so you need a medically necessary reason for a hysterectomy? We're going to find one.
Yeah.
Fuck you.
Yeah. Yeah. So much of it just comes down to finding the right person, which you can't always predict. But I've had so many struggles with insurance companies over the years, not just for trans-specific stuff, but just like in general, they're terrible. But I've had a few times where I just found somebody from the insurance company on the phone at random who like actually cared and knew what they were talking about. And we're just like, oh, just tell your doctor such and such and you'll be okay.
Mm-hmm.
Or like one time I was having trouble getting something covered under my workers' comp. And like I found somebody on the phone from the insurance company who was just like, oh, they're just missing like this interview or whatever. And she was like, I can just talk to you right now and record it and get the thing done and you'll get all good. It's like, oh, okay, thanks. And that was something that she didn't even need to do, but she's just like, I know what your issue is and let's just fix it right now instead of sending you through 10 more channels to maybe not even get it done.
Especially when you're neurodivergent and you have trauma. Any additional step, like add one more step, that sucks. Add 2 more steps, it feels like 10 more steps. 3 more steps, it feels like 100 more steps. It's exponential. So getting just one person who will meet you where you are and help you get where you need to be can quite literally be life and death, or groceries and not groceries. It can be so meaningful and enormous as far as quality of life. Also, if your doctor sucks, just don't keep going to them, but don't be like me and wait almost 2 years to find a new one.
Yeah, unfortunately, a lot of times we have to advocate for ourselves, which is hard to do. It feels like an uphill battle, and sometimes it is, especially like when you don't have self-confidence because of being trans and just because of your experiences of how people are looking at you and everything.
Or just
you got to do it.
Especially shout out to feminine people who get that extra dose of paternalism in medical care. And like textbooks are written usually based on like white men. So if you fall outside of that and your symptoms look any different, you're not going to be believed. I hate to give my birth mom any credit, but like she went to the doctor a few years ago and was like, there's something wrong with my heart. This is my family history. There's something wrong with my heart. And they were like, it's anxiety, go away. And then she went to another emergency room and they diagnosed coronary artery disease and she had 2 stents the next day. But it was because her symptoms didn't match the textbook, but hers were textbook women's cardiac symptoms. But because the doctors in the ER weren't familiar with the symptoms being different depending on your body, like she could have died.
Yeah.
So like good for her for advocating for herself. Fuck her as a person. But in this one case, if you're going through something and doctors aren't believing you, advocate for yourself like she did, even though she is awful. Be better than her, because you already are, I promise.
But even transphobes have to advocate for themselves.
Yeah. God, I hate her. I don't know. I'm trying to get to where I don't hate her anymore. I'm trying to not let her have that much space in my soul. But it's just hard.
Did I ever tell you the story about why I've been wearing broken glasses for like 2 years?
No, but I do know you have been wearing broken glasses for 2 years.
I have been. I actually like made an appointment to get my vision tested over a year ago now, probably. But I never like went to that appointment because when I was making the appointment for the optometrist, I was in the middle of the process of changing all my documents and everything. And so I forget what specifically it was, but I like had to tell them, just so you know, like the name of my insurance isn't going to match up with the name on my driver's license or whatever it was. And I was like, you'll have to file it like this because I changed my name and so on. It was a very like straightforward conversation. The person was like totally fine talking to me. After we had that conversation and like I made my appointment and everything, I guess he forgot to hang up the phone. And so I stayed on the line just because I wanted to hear what happened.
My soul
but
just left my body.
Yeah. So I listened to like almost 10 minutes of him talking about me with one of his coworkers.
And I'm guessing it was bad.
Yeah, it wasn't great. But like the first thing he says was, after this very normal interaction that I have with this person, like after he
hung up,
got off the phone with me, he's like, the first thing he says is, I just had the most uncomfortable conversation ever. It's like, excuse me? Just for me existing?
Did you ever leave a review?
I don't remember if I did or not.
I don't want to give me their phone number. I want to call and have a talk.
Yeah.
I just want to have a talk. Don't pay attention to the brick.
Part of the reason why I stayed on the phone line is because I wanted this guy to eventually come back to his phone and realize that I was still on the phone line. I don't know if he realized or not, but I like wanted him to have that realization. But anyway, it was like obviously an upsetting situation.
That's awful, and I'm so sorry.
Yeah. And like, of course, I didn't go to like that office because I was like, I'm going to be interacting with these people who were like talking shit about me because I'm trans. Like, obviously, it's not a safe space. Like, I know that now. So thanks for telling on yourself, I guess. But it also like, it took a lot of like personal energy for me to make the appointment to begin with because of general executive dysfunction. And also just like, that was a time when I was like changing all of my documents over, which is like takes so much work and energy to do. It's like a big deal. And like I was proud of myself for like getting all that stuff done, but it like took a lot out of me to get that done. And so it was hard for me to muster the energy to make the appointment, but like I did. And then after that happened, I just never made another appointment again.
Did you cancel the appointment or did you just no show?
I think I canceled it right after the guy finally hung up. I just got on the website and just canceled it right away.
That's good. Because, yeah, they don't deserve your copay or whatever.
No.
I don't know if you have even vision insurance or your any dollars.
Yeah.
Any quantity of dollars. If they don't like your trans self, they don't deserve your trans money.
Mm-hmm.
That's a nightmare.
Yeah.
That's awful. I need new glasses. My crooked.
Mine are super glued together in multiple spots.
That's charming.
Mm-hmm.
I really think my ears might just be crooked. I think they sewed my ears back on crooked.
Yeah, it's your dad's fault.
Yeah, for context, my parents decided my ears were too big when I was a baby, and when I was 3, they had plastic surgery on my ears to make them look better. And another thing I loved about my new doctor is his response to that when he was going over my surgical history was just like, "Oh, what was that for?" And I was like, "What do you mean, what was it for? It was cosmetic." And he was like, "What? Really? Wow." And I was like, "I agree. Maybe we shouldn't do cosmetic procedures on people who are too young to even understand what they are."
Mm-hmm.
For any reason.
But I bet you got a little dose of medical trauma out of that, even though you were too young to probably process it.
Yeah. And they did it to my oldest sister too. And she was 7. And her medical trauma about it is worse.
Mm-hmm.
Like, I would let her look at my scars when we were growing up, and I'd ask if I could see hers because I can't see behind my own head. She would never let me look at hers. But I was like, I just want to know what my ears look like from the back. I was never allowed to look at hers, which, like, now that I'm older and like understand exactly what had happened to me, I get it. But I was really annoyed back then because it's just like, I let you see mine. I want to know what my ears look like.
Yeah.
But Chris has taken pictures of it for me. It's a line with dots, like a line from where they cut and then dots from the stitches.
Mm-hmm.
But whatever. Medical trauma.
Yay.
Just, it's unfair that doctors can do things to children that isn't gender affirming, that they can't consent to. But then they won't do things to adults who are begging because they don't want someone to get mad.
Yeah.
But let's just cut off the 3-year-old's ears and sew them back on after we cut some extra cartilage off. For fun. For $17 because it was students who did it at a military hospital.
Really?
Mm-hmm. Yeah, my mom loves to brag that she got cosmetic surgery for 2 kids for a grand total of $34, including an overnight stay.
This story gets better every time you tell it.
Mm-hmm. It's things that I forgot that I even knew. But now that I'm thinking about it, it's just like, oh, that's part of that story too. I hate that woman.
I'm just constantly having like memories jostled loose through doing this.
Yeah, this podcast is like PTSD repressed memory recovery services.
Yeah.
What else do we want to talk about medically?
I think that's a lot of things.
Take care of your health. Don't be like me.
Mm-hmm.
Advocate for yourself. If you can't advocate for yourself, have someone you love and trust help you, like my husband did for me. If you don't have a Chris, just like see who's around you that might be willing to help.
Mm-hmm.
Friends are great.
Yeah.
And like, subscribe. I don't know. Donate if you're cis and white. Yeah.
Cis people buy us a camera.
Oh, someone's calling me, but I'm going to ignore it. It said healthcare. But it's not my doctor. It's probably the vet.
Yeah. All right. Well, I have been Robin. I have been trans. And I need to go hydrate to take care of my health.
I have been Ben. I have been trans. And I have been to the doctor.
Sure have. I'm so happy for you.
Thanks.
All right. See you brats next time. I'm going to keep a better eye on my levels over here in case it cuts off again. Technology is annoying. Bias microphones, guys.
Yeah, we need
cis people.
Cis white people, especially. Bias microphones.
Look at how guilty we are asking for things.
And even if you don't bias microphones, donate to a charity for marginalized people.
To get the microphones.